yeah, I mean, because that was our first, and we didn't know if it was a normal thing that happens. But now that we are like in our sophomore year of
Sophomore year.
Jaslyn was our freshman year of parenting. Now we're in our sophomore year of parenting, so we we kind of have an adequate
Wait,
idea of what to
but we
expect.
took in Leo, so technically, aren't we juniors in parenting?
Yeah, I guess you could say that it's that junior year that you actually skip
Okay,
your fully
okay.
sophomore year, and you got bumped into junior year because you came with credits
Oh, I came.
from previously. Yeah,
I love this.
that's right. You get the IB credits from high
Yeah.
school, and then technically you're not a freshman, but in year wise you're still a freshman because you're going through that experience for the first time. But in credit wise, you are a junior.
I'm a
So that
junior.
yeah, that's what it
Okay, I
is.
like it.
Yeah.
I like the
So
way you put that.
yep. Hello, I'm Tijani Musa.
And I'm Yasmin Musa, and this is how we're doing it.
Welcome to our How We're Doing It. Here we share stories about our journey and experiences of being first generation college graduates, our family, buying our first home, moving across the country, and living a debt-free lifestyle. We do so in an authentic, fun, and educational way to help other first generation immigrants with similar paths. So, Yasmin, tell me, what are we talking about today?
Today's topic is going to be on the first trimester of pregnancy, and for us, specifically for baby number 2.
All right. So let's just say that we had a baby announcement in a previous episode, and now we're following up with this episode to give an update on how you are doing right now.
Yes. So we just concluded first trimester, which for those that don't know, pregnancy is divided into 3 different trimesters.
Yes?
And the first trimester is from about weeks, basically 0 to 14.
Yes.
Second trimester is weeks 14 to, I want to say 28.
Okay.
Let me look it up because now I want to make sure that I'm right.
Right.
Okay, 13 to 27, actually, it says.
Okay.
I,
So-
I think it's more like 14, though, because my doctor said it's at 14.
Okay.
So 14 to about 28.
Okay.
And then third trimester is 28 to 40 weeks.
Okay.
And so we just finished our first trimester, which it's actually considered like the riskiest trimester just because of the fast pace of growth, but also in terms of like the development of the baby.
Right.
And then also it's kind of risky.
Right. Miscarriages are also possible.
Miscarriage is at a high risk.
Right.
So actually a lot of pregnancies sometimes do end up in miscarriage, and there can be many reasons why that is, but
Right.
you just kind of have to be prepared. Like that's why they say when you're having a baby, it's best to wait to announce your pregnancy until you're done with that first trimester, because that's when your risk of miscarriage dramatically decreases.
Right.
Now, it doesn't mean that it can't happen, because it can happen up to about, I think, 20 weeks. It's still considered a miscarriage. Anything after 20 weeks is called a stillbirth.
Okay. There's a very important thing that you just mentioned about announcements, right? You said that announcing you have to wait. Like that's like
They
when
recommend you wait.
right, that people that want to announce it on social media or something like that, you can wait until you're certain that the risks is lower. But this is what I wanted to say. If you have like a community of women, right? You have like your own little village, because it's something that you've shared with me before, where you told close friends. When I say close friends, these are friends that are very, very, very close to you, right? And if something were to happen, say there's a miscarriage, you think that those people that know can become like a support system to you. So it very, very important. I did not think about that at first, because I was like, okay, we're not announcing it, we're gonna keep it close. But when you mentioned that to me, it just made sense to me. It was very, very smart idea to, if you have like very, very close knit friendships or people that you trust, you could share with them, even if it's early, just in case, at least you have that support system that they can check in with you. Or God forbid, a miscarriage happened, at least you're not going through that mental drain by yourself. You have like a support system with your partner as well.
Yeah, on my last episode, or the last episode we recorded regarding the pregnancy,
Yeah.
I talked about how this time around I was a lot more vocal, and I did share the news with more people and just the moms in my tribe, because I did want that support system should anything happen. And one of the biggest reasons for that is, so with Jasleen, our pregnancy was pretty much non-eventful. I did have some bleeding during that first trimester, unexplained bleeding basically, because they can't really tell you why it's happening.
Right.
Or at least I never really got an answer as to why that was. And it happened less frequently though. And then with this pregnancy, I was pretty much spotting and bleeding for weeks. So, and then I started experiencing some pain on my left ovary. And at that point, I was like, this doesn't feel normal. Like, I don't think things are okay. So we made sure that we communicated with my OB as soon as we could. And I was able to get an early appointment just to confirm that the pregnancy was where it should be. That it wasn't, nothing, it wasn't growing like in the ovaries or anywhere else, that it was in the uterus, and that that there was actually a heartbeat, because that's one of the big things. Like in your first appointments, that they're looking for a fetal pull, that's what they call it. They're looking for that movement of a heartbeat, because that's what tells the doctors that this is a viable pregnancy.
Right.
And so we went for that appointment around 6 weeks and confirmed everything is where it should be. It appears that the baby is okay, that there's a heartbeat, and we were sent off. But we still, because of the unexplained bleeding, we were still told to be careful, because there was a risk.
Right.
You never know.
Yeah.
The bleeding could be normal, it could not be normal.
Right. Yeah, it's one of those things, because this is like you mentioned, Jasleen's pregnancy was uneventful. That's the term. It's a positive thing than having a pregnancy that is eventful, which comes with questions and all those type of things, issues. But this one, definitely brought about bleeding in the earlier on, and so we took the proper precautions.
More frequent and continuous. That was that was the biggest.
That's the concern. Yeah.
But thank God everything's okay, and we've made it past first trimester. Baby is now 15 weeks.
Yes.
So that's huge.
Yes.
We're very excited at this point. We've shared the news with our family, our close friends.
You.
Yeah. The listeners know.
Yeah. Yep.
Who knows, by the time this episode airs out, who knows where we'll even be.
Where are we going to be?
In terms of the pregnancy, right?
Yes.
Maybe the baby will be here for all we know.
That's right. You never know. So
funny.
Exactly. But everybody knows. And so we don't know where the baby is going to be developmental wise. The baby could be here, or the baby could still be in the oven cooking. So, yeah.
So, just going in a little bit into because last time we spoke, the biggest thing was the nausea.
Right.
I remember I was just venting about how the minute I found out I was pregnant, that nausea started. And unfortunately, we're at 15 weeks and it hasn't stopped.
Yeah. Remember we had an episode where we talked about the morning sickness, air quotes, morning sickness.
No, it's all day sickness.
This is all day sickness. Matter of fact, this is, at this point, it's like weeks.
It's been awful this time around.
Yeah.
And I mean, from all the people that I know that have had more than one children, everyone said every pregnancy is different, right?
Right.
So you can't compare. But man, it's so hard to, because with Jasleen, by now I was glowing. I was feeling so good. My energy was back. And with this pregnancy, I'm still nauseous.
Is nausea
all the time?
Is nausea associated with the gagging, like to vomit?
Like the dry heaving, like
Dry heaving, yeah.
yeah.
It's the same. Okay.
Bleh.
Uh, that's a sample right there.
I wouldn't think about it.
Ju-
Stop it.
just talking about it. But anyway, that's what personally speaking, I think you're glowing.
No, I don't think I'm glowing. It comes, so the nausea comes like if I'm hungry, which I'm hungry all the time. Like food tastes so good.
Yes.
But I don't want to eat the same food more than one time.
Very important.
Very picky baby.
Mm-hmm.
And like opening the fridge will make me want to vomit.
Yes.
If I eat too much, that'll make me want to vomit too because my stomach's too full. So the best way they say to like fight it is like eat smaller meals throughout the day rather than big meals.
Well, hopefully when you're listening to this, you're not gagging as well or dry heaving or whatever the case may be. But one thing I wanted to mention is that with Jasleen, I remember around this time of the year, around this time of your pregnancy, was this the time where you had like food aversions where I could not talk about chicken or eating?
No, that was like early first trimester too.
Yeah, but this time around is different though. Like,
yeah, because I don't have as many food aversions.
Right. Because I remember like with Jasleen, I can't even think about chicken. You're like already.
Like, I want to throw up.
You want to throw up.
This time around, like I can tolerate chicken, turkey. Like
right.
I can tolerate those things. The only thing is chicken broth. I don't know what it is about chicken broth. I think
I don't know, maybe the smell. I don't know.
It's the smell. Like I remember I was probably like not even pregnant yet, but I got sick and I made some soup with like the chicken broth, like a lot of flavor, and it was so good. And I remember I loved it, but I haven't been able to smell chicken broth since
then.
Probably like week 3 or 4.
Yeah. I remember. I mean, I don't want to talk about chicken broth and then you're gonna vomit on me.
Let me
but
not think about it.
Yesterday, I was trying to get a cup of chicken broth and you were like yelling at me in the kitchen. Get this out of my way. Move it. I'm like, okay. Give me some time. But but in terms of like food aversions, it's different. In terms of like dry heaving, it's also a lot more compared to the first pregnancy.
There's also real like actual vomiting this time.
Yes.
Which I had. I could count with my hand like the amount of times I actually had vomiting with Jasleen, and this time around I lost track. Like I'll wait. Sometimes like I would wake up and throw up, and there's nothing in my stomach except like my stomach. Like
saliva.
Vial. I don't even know. Like my stomach contents, you know, but not like food because I haven't eaten because I've, you know, I was sleeping, but I would just be throwing up like my saliva basically.
Yeah. Let's call them the stomach
gross.
elements.
It's so gross because then it happens and unfortunately I started showing a lot earlier. That's not unfortunate, but my bump is there.
Right.
And so anytime that I do have vomiting, I feel like the energy being drained out of me, like literally. And I get really worried that as I'm making the motion to vomit, as my body's doing that I'm hurting the baby.
Right.
Because, like my bump grew so much faster this time around. And so I worry that I'm hurting the baby as my stomach is like squishing itself to release the vomit. That's my biggest fear.
Yeah, you've shared that with me, and you think that because, like you said, when it's happening, like especially the one that happens early on in the morning, you don't have any food, and you feel like your rib cage is about to fall off.
It's squeezing, it's pushing the baby.
Yeah, so that's a very interesting thing to also having in the back of your head. You know, when the key is that every pregnancy is different, every kid is different, so. That is pretty much the message that we want you to take away from this. Because when we compare our pregnancy today to the one that happened with Jasleen, which is over 2 years ago, now it's the experience is kind of different.
Yeah. I would say like too, like the other thing about the vomiting is like when it happens, because it takes so much energy from me. The rest of the day, I'm pretty much gone.
Mm-hmm.
Like, I'm just tired. I just want to sleep, and I don't want to do anything, and I don't even want to eat. Like, that's the thing, is that it happens, and then I just feel sick the rest of the day, and I don't want to eat. So that's been pretty hard.
Mm-hmm.
It has gotten better. The past couple weeks has been more so, like the past 2 weeks has been more nausea, no vomiting. So we're hoping and praying it gets better. But this is the reality of pregnancy. Like, I feel like these are the things that sometimes people don't talk about. You know, you talk about the nausea maybe. You don't talk about the bleeding. I know the first time the bleeding happened on my first pregnancy, we were like terrified.
Yeah. Yeah, I mean, because that was our first, and we didn't know if it was a normal thing that happens. But now that, you know, we are like in our sophomore year of Jaslyn was our freshman year of parenting. Now we're in our sophomore year of parenting. So we kind of have an adequate idea of what to expect.
We took in Leo, so technically, aren't we juniors in parenting?
Yeah, I guess you could say that it's that junior year that you actually skip your fully sophomore year, and you got bumped into junior year because you came with credits from previously. Yeah,
I love this.
That's right. You got the IB credits from high school, and then technically you're not a freshman, but in year wise you're still a freshman because you're going through that experience for the first time. But in credit wise, you are a junior. So that's what it is.
I like it.
Yeah,
I like the way you put that.
Yep. So we are junior, and then so we're doing it. So we have a little idea of what to expect, and so we're using our previous knowledge and combined with the current knowledge to make decisions for what to come. So that's how we're approaching it.
How else do you think it's been different this pregnancy?
Well, this pregnancy.
What are some things that you're like seeing again?
Yeah, that's a good question. One question that I asked in the previous episode that I also want to bring up is when it comes to like intimacy, how the first trimester you don't want any. You said you're touched up. That's the term that you used last time, right?
I think I used touched up when we were talking about breastfeeding.
Oh yeah, okay, that's a different episode. This different episode. So how are you feeling now that we are
like first
starting
trimester,
to try? Yeah,
there was no type of sex drive. Like I already had the baby in me. Don't touch me. Don't even look at me. Nothing. Like if anything, like I wanted like you to just like cuddle me, like be sweet with me.
Yeah.
But not like in a sexual way. You know?
Right.
But you don't know how to draw that line.
So. Hey. I feel attacked. I'm just a cuddly guy.
I knew the minute like second trimester came around because all of a sudden I was like, why is he looking sexy?
Oh, yeah.
The same man that I've been disgusted by.
Exactly. So now.
For the past like 12, 13 weeks.
Now you want to be touched.
Now I'm like, ooh.
Why isn't he touching me? Why is he passing by? I'm in the bathroom brushing my teeth. Why is he not looking at me? Why is he passing by me, not grabbing me? Those type of things. I'm the same guy. I still got the dad bod the same way.
I know, but 4 weeks ago you were yuckas.
And well, now I don't want to be touched.
Now you're touched out.
Yeah, I'm touched out. Matter of fact, I'm looked out.
Oh, okay.
Don't look at me. Don't talk to me.
Too funny.
But it's one of those things. You know, you just gotta. You know, it's a patient thing. You know, you just have to communicate with your partner. You know, if you feel touched out, you know, just communicate with them. If you ain't feeling the drive, you know, just let them know the drive ends in there, and they can wait. And Yazmin already specified different things that you could do in another episode. So go back.
I did not go into.
I
didn't go into detail.
It wasn't detailed, but you said that there's more than just penetration.
You love saying that word.
I love the word because it's so biological.
Okay. No, but I think like another big piece is like during pregnancy, I'm exhausted.
Right.
Like
that's important too.
I want to sleep in every single day. I love my sleep, but I want to sleep in every single day, and I would if I could, if I didn't have work.
Right.
I, even in the afternoons though, like my energy, I'm like so tired that I need to nap. And like the other day, Tijani it was in the afternoon, like after dinner, and he's hanging out with the kids, and all of a sudden I just
Yeah,
left.
yeah.
I literally, I didn't say anything. I just went straight to the room, laid on the bed, and I knocked out immediately. Like immediately. And I was gone for probably a good 30 minutes. And then you came in and checked on me, and I woke up feeling like a completely different person. I'm pretty sure I was building like a brain or a kidney. I don't know, one of those big organs, because I was so exhausted at that very moment.
I guess when the baby is growing, it needs you to be sleeping for it to grow.
I don't think that's how it works, but that's how it
That's how
feels.
you feel, exactly. But yeah, it. But in terms of like things that are different from my point of view, from Jaslyn to now, I mean, for me, especially for me, like my approach, there aren't that many different things in terms of things that we've done before. We used to do like we take pictures of the pregnancy and just track the pregnancy through like different vegetables, like pictures we get from the apps that we've talked about before. What to Expect app, the Baby Center app, all those apps. They give you the Huckleberry app. They give you like status updates of what the baby development is. And so we use one of those apps to take pictures. Yasmin would take a picture of me holding like a
A
vegetable,
blueberry.
a blueberry for
Or
that.
like this week we're in apple. So
Mm-hmm.
I would have taken a picture of you in an apple. We're not
Exactly.
doing that this time
We're
around.
not. We're tracking it on the app instead. So for that, we're not doing that because I mean, first of all, I guess we don't go to. We go to the store about the same amount, right? On a weekly basis to like get
No.
groceries.
I mean, it's just different. Like we have two other kids to take care of.
Yeah, it's a lot more
So
busier now.
why are we gonna
Yeah.
take the time to take a picture of you in the fruit? I mean, it's cute, and like we did it with Jaslyn, but we're not repeating it this time.
Yeah, we're doing something different. This time around, we're tracking it on the app. Yasmin has a different app, and she added me to the account, and I'm tracking it, and she's tracking it. So that's what we're doing this time around. In terms of like on the day-to-day things, Yasmin takes a lot more naps than we do, and
Okay, you make it sound like I sleep like a cat, like 3 naps a day. It's like one, if that.
okay, you're not a cat because the cat they sleep longer time, 16 to 18 hours, or is it cat nap?
It's a cat nap.
Cat nap. Okay. So that is thing, and then the thing that we want to start up again from previous uh pregnancy to now is do like family walks, like exercises for Yasmin and myself and the kids. So as the weather is getting warmer, we're looking to do more of those things where we do like walk and then go to the park, spend time with the kids, those type of things. So it's different from first pregnancy when you're dealing with one baby that was in the womb to now that it's a second pregnancy. We have Jaslyn to respond to her needs, and then we have Leo to also respond to his needs. So it's different for us at the stage that we're at now. So we're just going through this pregnancy based on the stuff that we got going on, and so we adjust things the way things come to us. So that's how we're approaching this one.
I think the other thing too is because we were basically put as like risk for miscarriage at that 6-week appointment.
Mm-hmm.
The doctor was basically like, just monitor your activity level, and if you notice that when you're doing a lot, that's when you're having the bleeding and spotting, then just relax.
Right.
And I did notice like those days where I was more active, sometimes I would see a little more spotting, and so that really kept us from focusing on any type of physical activity. Like
Right.
we weren't having any sex.
Right.
We weren't
You want lifting
oh yeah, even she said like like I shouldn't be lifting or pushing very heavy. No lifting more than 45 pounds, I think.
Mm-hmm.
No pushing more than 80 pounds.
Yeah.
What else did she say? Oh, like the activity, right? Like
Yeah.
walking, like the physical activity, like the actual walking or running or exercising in general.
Yeah.
And so we were very like, just conscious of that and careful when it came to how much we were doing. We were walking a little bit, not every day, but we were walking at least a couple times a week before I got pregnant. And then with with all the spawning and everything, it was really hard to get back into it. But now we are.
Yeah, now the weather is getting warmer. It's getting nicer over here too. So we're looking forward to, as we transition into the second trimester, we're also looking forward to transitioning to being a little bit more active, because it's good for you, and then obviously it's good for me too, and the baby.
Yeah.
And the kids.
The kids love it.
Yeah, that's
obviously the outdoor time.
Yep, that's how we get them outside of the house, and then also
some energy.
Burn their energy.
The other day we went on a walk, and Jasleen walked 2 miles.
Yeah, the whole time, 2 miles. At the end, she was like dying pretty much.
She was wobbling like a penguin.
Yeah. But she did it though. She's 2 years old, 2.5 years.
And here's the thing, like we brought her wagon and we were like, okay, sit in the wagon. She would say no.
Yeah.
And then you would want to carry her and she would push you off. Mm-hmm. So she wanted to continue walking, even though she was tired. Yeah. Her feet were hurting.
But I can only imagine because.
No, yesterday my mom was rubbing her feet and she was loving it. I bet you she was sore.
Oh, yesterday I took her on a walk in the neighborhood. She didn't want to walk.
Really?
Yeah, she wanted me to carry her the whole time.
She was sore.
Yeah.
You should have figured she was probably sore from the walk.
I put her down to walk. She lay down.
I would have done that too.
Yeah, like a sloth. Like I put her down, she just lay down. And I'm like, okay, I'm gonna keep walking. And I'm walking like 5 yards. She's still laying down. I had to come back and pick her up.
She was tired from the day before.
Yeah,
we didn't walk yesterday. Yesterday was a rest day, and that was probably a good thing for all of us.
Yeah, it's crazy. She's like, you brought me out. I didn't want to come out, so now you have to carry me. I carry her the whole neighborhood.
Oh, that's hilarious.
Yeah. So, but it is what it is. It was fun. This is a thing that me and her do every day that I have a chance to step away from work. I would take her on a neighborhood walk. So
yeah,
it's pretty cool.
I think going back to the pregnancy, I think another big symptom I've had is I am so emotional. I will cry over everything. And normally I'm an emotional person, but I feel like it's very heightened right now.
Yes.
Don't be mean to me because I will cry.
Yes. I try to measure what I'm going to say next so you don't cry. But yeah, she is, I have to be on a fine line when I walk and move and talk. So all of those things. But overall, yeah, I mean, it is what it is. I just have to adjust to the needs as they come.
Mm-hmm. Exactly. As far as like eating wise, I feel like because of the nausea, I don't think I'm eating as healthy as I could be. Because sometimes, like I said, I don't want to eat the same thing over again. And I just want to like have different foods, but not like sometimes my body will crave like vegetables, and that's how I know like, okay, I need some veggies in my life or some fruit. Yeah. But most of the time, like my cravings are like salty things. Yeah,
that reminds me actually. With Jasleen, you were craving a lot of Mexican food.
Yes.
Right? What would you say is your number one craving for this time? Like anything specific? Because I remember you sharing that you were craving Mexican food because those were the food that you grew up eating. Is there a particular food that you're craving this time?
No.
Okay.
Not really.
That's also different.
Yeah. With Jasleen, I did all my cravings were basically like, you're right, like the food I grew up eating, Mexican food, right. Antojitos, basically cravings. Think of your empanadas and all the yummy Mexican food, tostadas. But this time around, I don't know. I'll eat it, and I like it, but I don't crave it. I can have it one time and be like, okay, I'm done.
Okay. Well, we don't have like a particular food type that you're craving this time. I mean, it comes and goes. Like a couple days ago you really wanted veggies, and you think veggies, the same veggies that we've eaten before, this time around you think they are just so delicious.
Yeah, because the food tastes really good right now. That's
Right.
why. Like it has a different flavor to it. Like I
Right.
eat and I'm like, oh my god, this is delicious.
Yeah.
I will say that like the other day, this was like a weeks ago, but you had made cassava leaf.
Potato leaves.
Oh, potato leaves.
Yes, from Salon.
Which I normally like. I'll have the
A
Sierra
little bit.
Leonean food a little bit with Jasleen.
Yeah.
When I was pregnant with her, I did not like the Sierra Leonean food very much.
Right.
But with this pregnancy, oh my god, it tasted so good. And I remember telling you, I'm like, oh my god, this is so good.
Yes.
And I was like, the baby likes it. The baby likes it.
Yeah,
I'm pretty sure it's the baby.
Yeah, that's how it is. When Yazmin eats something, we put it on the baby.
Yeah.
Because they can't talk and they're not here, so we can put it on in as much as we can.
Anything that anybody offers, I'm like, yeah, I'll take a little bit for the baby.
Exactly. So, exactly. Just to wrap up this episode, the key takeaway is that all pregnancies are different. That's one thing, and then secondly, just listen to your OB, listen to the doctors or your support system around you, especially from the medical side. Ask questions. Advocate for yourself.
Come with questions like typed up on your notes on your phone.
That's right.
Because in the moment you forget, they're like, "Do you have any questions?" And you're like, "No."
Yep.
But maybe you do, and then you miss that opportunity because you didn't write them down.
Right. No, that's important too. Come with questions. And then ask the questions. They will answer the questions. If they don't know the answer, they'll tell you, okay, I need to look this up, and I'll come back to you. I'll give you a call or let you know. If it's not urgent, they'll be like, I'll let you know in your next appointment. Those type of things. But it's very important to ask questions, especially if you. For us, we're in a position where, luckily for us, most of the appointments that Yazmin go to, I attend the appointments, and so if she's not thinking of a question, I would ask the question. And then after that, we go through questions that we come up with. After that, we just freestyle. We just ask questions based on what we hear. If we need a follow-up question from what the doctors are telling us, we can ask that follow-up question, and it works for us in that sense.
Yeah, and we don't know the baby's gender yet.
Nope.
We will be finding out in a week exactly.
Yeah.
I mean, we have the envelope, but we're waiting to do a gender reveal with our families.
Right.
So we're waiting.
Maybe we'll let you. Yep. Maybe we'll let you know in another episode that we'll record.
Yeah. Maybe when we do like the second trimester update.
Right. Exactly. Anything else?
No. Wish us luck. Pray for us.
That's right.
Okay, bye.
It means a lot to us. Thank you. Thank you for listening to another episode of How We're Doing It. We want to hear from you. Contact us at hwdipodcast@gmail.com or leave a comment. If you like the show, consider subscribing in order to get notified of new episodes. Thank you for listening, and we'll see you again on the next episode.
Mama. Bye-bye.